All right, can everyone see the PowerPoint? Yes? All right. Woo! Thank you. Successful. All right. So thank you for joining us today. We're going to go through the Older Americans Act Title III funding RFP and answer any questions that you have. So we'll go through it, just what to expect really briefly, and then answer any questions as they come up. So please feel free to put anything in the chat. We have someone who will be monitoring the chat and let us know if there's any questions that come up. And this recording will be posted on our website. So you can always look at it after if any questions come up as you're working on your RFP. And I'm going to start. Uh-oh. There we go. So like I said, my name is Meg von Lassitzer. I am the director of community programs here. And I also want to welcome Lisa, who is joining us. Do you want to say hi, Lisa?
Hi, everybody. I'm Lisa Gregoni, CEO for Mystic Valley Elder Services. We're excited to see you here. And thank you to Meg and Katie also as on the call from our community programs team that work really hard to put this both RFP together and presentation. And so we are excited to kind of present our information for the current RFP, which is on our website. So I'm going to turn over to Meg. She's been with Mystic for, I don't know now, how long you been, Meg, with our
organization? 8 months.
Wow. 8 months.
9 months.
Fabulous job, though, as our director of community programs. So we're lucky to have her, and we're happy to see you all here today. Thank you.
Thank you. And Katie, do you just want to say a quick hello as well and introduce yourself?
Sorry, trying to figure out how to unmute myself. I'm Katie. I'm the community programs coordinator here at Mystic Valley. I work directly under Meg, and I've been here since November, so not super long, but learning a lot definitely these days with Meg for sure. So happy to be here. Happy to meet you all.
Okay. So for anyone who's not familiar with Mystic Valley, we do serve 11 cities and towns throughout the region listed here. And we're really looking to support the rights of older adults and adults living with disability to live independently and with dignity. And so we offer lots of services throughout this area to try to meet those needs. Oh, geez, I keep trying to click. And what this funding is specifically through the Older Americans Act, which is a federal act that is to support older adults to live in their homes or in the community with dignity and independence for as long as possible. And so like what it says in the RFP, this funding is specifically to benefit persons ages 60 or older and those that are caregivers of someone in these 11 cities and towns that we serve. And more specifically, it's to serve those with the greatest social and economic needs. And these are coming from the Older Americans Act that give us the funding and are asking us to make sure that we are meeting these needs in the communities. So using what comes out from the Older Americans Act, we have priorities of where we are looking to have our funding, our Title III funding to go this funding cycle. And there are 5 of them. So the first one is health promotion programs. And so these are evidence-based programs, things like chronic disease self-management, diabetes self-management, things that have evidence behind them to show that they are going to help improve the health and well-being of older adults. The second one is support service programs. So this can be any sort of assistance for older adults to remain in their community, to have access to transportation, case management, information, referrals to services, in-home services, and also legal services. The third one is family caregiver services. So this is providing support to those that are helping to care for those in our community. So this could be caregiver counseling, group support, caregiver training, anything like that could be sitting under this. We also are looking for support around the social engagement services. So one of the things that came up a lot is wanting more opportunities to reduce isolation of older adults, and so finding ways to engage people in the community. And then, as everyone knows, one of the biggest issues in our area, as well as in a lot of other areas, is housing. So finding housing resource assistance, so helping individuals acquire and retain affordable housing, as well as avoiding eviction, if that's something that is happening for them. So we are anticipating giving around 5 to 6 awards this funding cycle, that will range between $5,000 and $15,000. However, we do want to add that this is contingent upon us receiving the federal Title III funding from the federal government. So if that comes through as we were expecting, that is what we are anticipating giving out for our award. Each one of the contracts will be for 1 year. They start on October 1st. We follow the federal fiscal cycle. So October 1st is the start of the contract. And it is a 1-year contract with a possible 1-year renewal. So after the first year, it will be assessed on whether or not we will be moving forward with the second year. There are requirements within this. They are both state requirements and federal requirements because of the funding coming through the state and federal government. There are volunteer contributions. Anyone who is working on the contract has to have a query check. And then there are ADA requirements, and that is written out right into the what is reported to us and what you are filling out in the RFP. So all of you should have received a copy of the RFP as well as the application. The application is a fillable PDF that walks you through all of the different sections of it. And each one of them has different required character or maximum amount of characters. So there is a cover page that is required in which you will select what type of program you are looking to fill out or to apply for. There is the organization description explaining a little bit about your organization and how you're going to be able to meet the needs that we're looking to do. The program description, so that's going much deeper into what are you looking to have this funding support. The next one is the program management. So what is the process to oversee this program, make sure that things are going to be happening. And then the program output, outcomes, and evaluation. It's really important that there's a way that you are evaluating what is happening in your program. How are you going to be measuring it? How are you going to be reporting it back to us? Some of the requirements, as I was mentioning above, is diversity and underserved populations. So having a section that you can define what is your process for that to make sure that you are meeting the populations that we are looking to serve. And again, like I said in the beginning, this money is for ages 60 plus. And so what's your process for verifying that that's the age of the programming is going to that age population? It doesn't have to always be just people that are 60 plus, but the majority of the people that are being served by this has to be 60 plus. And there needs to be a way in which if someone would like to voluntarily contribute to this work, that there is some sort of policy that says that it's okay for them to do that, but there's no requirement that you're not charging any money for people to participate in anything that is funded through the Title III. And then there are a lot of attachments that are also a part of this. And so this allows to have some opportunity to attach the different sections. So the first parts are the budget. So we'll go a little bit deeper into the budget and what does it mean to have matches in a little bit. But attachment A is the budget. Attachment B is the budget narrative and justification. So what is on the budget and how does it meet what you're looking to achieve? If you have staffing on the budget, we do need to have a job description and resumes of any key personnel that are going to be on there. And remember, it is important that anyone who is on the budget has to have a query check as well. So if it's not something that's standard practice for your organization, if someone is going to be paid through this budget, they have to get a query check. Evaluation tools. So if there's an evaluation tool you're using, especially if it's an evidence-based curriculum, they come with evaluation tools. What are they? How are you going to be using them? The age verification method, if this wasn't answered above in that question, because if it is a policy that's maybe a little bit longer and doesn't fit into that higher section, you can just attach it down here. And the same with attachment F. If it's not in the narrative, you can attach it down here. The audited financial statement to show for your organization. Any licenses that need to be attached as well. We also need evidence of liability insurance, and it is required that we have an evacuation or disaster plan as well. If you have any questions about any of those, please let us know. So the budget, this was something that has come up. Oh, we do have a question. You can unmute yourself. Oh,
I have a question.
Yep.
So the budget mentioned about that we need to have an audit report that we are not that much money required audit. Can it be just 990 report?
Lisa, do you know the answer to that?
No, I think we have to take the question back. I mean, is it specified in the audit requirement? Go back to that slide. I'm sorry. What the other slide was to say. And just so people understand, these requirements are federal requirements. We are not requiring anything that we unfortunately would make it more difficult for you. The federal government does require this. So they need to put an audit financial statement. I think the 990 would cover that. Is that what you're talking about? Is that your question, May?
Yes, yes.
Yeah, your 90 would cover. Yeah, 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 it should be fine. Yeah.
Hello, good morning. This is Elena from MAPS. Thank you so much for this conference and for sending us the link. My question is also about the budget. We are used to sending a budget justification in the same file as the budget narrative, but I see that here there are two separate attachments. Can you please explain to us what is the difference, or how can we make an attachment B of budget narrative that is separated from the project budget?
If the budget narrative and justification is included in the budget and it's explained in the budget, it can, A and B can be kind of put together into one. Just put that in the title of it. That's attachment A and B, but just make sure that in the budget that there is a narrative and a justification for anything that's in there.
I was just asking if you have any other format that you would prefer for the justification.
Oh, no, that's up to you.
Thank you.
Another question I have, sorry. So this is Mei Hong from the Chinese Culture Connection. In terms of the evacuation and disasters plan, say if the event or the program is administered in the senior housing or at the senior center, would that be that we request the senior housing or the senior center provide such a thing, since we are not knowing how they would have such plan?
I mean, my answer, I think you'd want to work with your partner. So if you're partnering with the housing or the senior center, maybe reference that you'll talk to your partner about the evacuate, speak with them about evacuation. I mean, you have to talk to your partner about what their plan is. You wouldn't necessarily need to put their whole plan in, but like show that you've discussed this with your partners, which is to where the event's going to be held. That's what I would suggest.
Wonderful, thank you.
So just going a little bit more into the budget requirements. So because this is federal funding, it is required that there is a match associated with any funding that comes through Title III. So it has to be a non-federal match. So for all of the funding sections, it's 15%. However, if you decide to do the caregiver program, the requirement is 25%. The federal funding, so what that, just to say it in another way, is that the federal funding may not pay for more than 85% or 75% of a caregiver project. The organization must cover 15% or 25% for caregivers of the total cost. I'm just going to break that down again in another way. So when you're thinking about calculating the non-federal match, the match is required to be calculated from the total cost of the program. So to find the total cost, you have to take whatever you're asking for. So the example we talked about here is a $10,000 grant, and it is a non-federal match of 15%. So it's one of the funding that is not the caregiver funding. So a 15% match. So you would take the $10,000 and divide it by 0.85, and that gives you the total cost of what the grant would be, which is $11,000, or what the program would be, sorry, which is $11,765. And then you take that and multiply it by 0.15, which is the 15% match. And so in the funding cycle, you have to put in $1,765 worth of match to show that the total cost is not more than the 0.85 that this grant is funding. Client contributions cannot be used for this match. So just really important to think about that as well. So I just wanted to go through that, make sure everyone understands it, because I know it is a little bit confusing because it's more than what the grant is you're asking for, and the percentages are different depending on what you're asking for. So if anyone has any questions about that, please let me know, and I'll be happy to talk through it again.
Yes, I have a question. Mei Hong
Sure.
again. So this match of a 15%, does it need to from the organization itself, or can it be from other funding that's non-federal?
Lisa, correct me if I'm wrong, but my understanding is it can be from other funding as long as it is not federal funding and it is not client contribution funding.
Great, thank you.
Yeah. So just to go through the evaluation process, so each one of the sections that you sent in have a percentage that's a part of it. We did put that in the RFP, but I just wanted to have it up here as well to just show you how each one of the sections are weighted. When the applications come in, they will be reviewed by the Advisory Council RFP. We do have one of them on our call here today, Suresh, if he wants to say hello. But they will review all of the applications and put together their recommendations of who they would like to fund for this. That will then go to our full Advisory Council in August, who will take a final vote on who they would like to recommend for funding. And then that will go over to the board for final approval. If we do get an application in that is incomplete, we will not be able to review it. So please make sure you complete your application when you send it in. If you have any questions about this, please reach out to us because we do want to be able to review all of the applications. So please make sure that you reach out if you have questions about a complete application. Suresh, do you want to say hi?
Hey, hello there. Yes, I was part of the process last time round, and this time I decided to, with Meg's help, to join you from the beginning. I just reinforce what Meg just said. Please ask for any clarifications, because the last thing you want is something to get held up over some minor item in your application. Okay, Meg.
Thank you. And here's just some important dates. So just a reminder, the proposals are due on Friday, July 25th. And we will be reviewing them, going through the advisory board and the advisory council and the board in August, which will allow us to give notifications of funding on August 29th. We will hold a grantee onboarding in September for anyone who is funded, just to go through the reporting process and what to expect. And you'll get your contracts to sign as well. And then, as I said before, October 1st is when the new funding cycle starts. So that's when the funding will begin and all of the programs will start.
Meg, can I just add something here about the funding? So, you know, we held off on issuing this because we were not sure about the federal funding. I know the federal budget's been a little off, but we are pretty confident at this point that we will have funding for this fiscal year, or this federal fiscal year, October 1. So that's a good thing. I guess the question will be for next federal fiscal year, just given all the changes nationally. So we are pretty confident. That's why we put this RFP out. We held it until we knew we had some confidence in that. So it's not likely that this funding, you know, we're likely to have the funding. We're pretty confident, but of course, anything can always change in DC, as I'm sure you're all seeing. But at this point, we're feeling confident, but for the next year, it's still hard to tell. And again, we do apologize. We do have less money than we had last year if you were a grantee, and the year before, because there was a lot of ARPA money that had been infused in the Title III to support older adults. And unfortunately, that money has been pulled back. So we are unfortunately having less options this time for money. Just wanted to let people understand the federal landscape. This is federal money. And so we are beholden by the whims of Washington on this. There's another question, Meg.
Yep. Lisa, do you want to unmute? I don't know.
Sorry, couldn't figure out how to unmute. So to kind of go off of what you were just saying, Lisa, if there's less, so when I was working on our budget, I mean, we've expanded our program. So the number that I came up with to request is actually more than what we've gotten in the past. Do you recommend that I just put in for what we actually need and then you would come back and give me a lower amount, or would you suggest I come in at a lower amount?
I think we were requesting grants up to 15,000, correct, Meg? So that is the max. So
Okay.
Anything up to that amount can be requested.
Okay.
But of that, unfortunately, we just can't with the budget we have,
Okay.
consider.
Okay, yeah, so we didn't have that maximum amount last year, so I'll go with what I had. Okay, thank you.
Meg, I have one question.
Yep.
It came up in a discussion, which was the client contributions. Typically, I'm not talking about the federal programs. Typical programs at COAs and so on, any contributions just go back into the general funds. Are there any restrictions on what happens to the client contributions with federally funded programs or partly federally funded programs?
I can answer part of it, and then Lisa, if you want to jump in at any point. So what I know about the contributions is that they have to be voluntary. So there can't be any charge for them. No. So I know at COA sometimes there's like a very, very small charge sometimes for activities. These programs can't have a charge. It would have to be a voluntary contribution. Right. I'm not sure on the other side, Lisa. I don't know if you know about if there's something.
What was the question? I'm sorry, it wasn't.
My question was really, could those contributions, the voluntary contributions, just go into the general funding of the organization, or do they have to go to some specific part?
We'd have to take that back to Sean, our CFO, and see. I don't have the answer. I'm sorry.
Okay. Because I have seen programs where there's usually like a jar that says voluntary contributions, and even sometimes a suggested contribution, but all voluntary. I'm just wondering where that goes, if there are any restrictions on it, that's all.
Yep, so we can...
Yeah, we'll take that back. I know for our meals program, we do give it to our meals. So when we have COA lunches, it goes to the meals program, but I don't know for the program. I don't think we traditionally get a lot of voluntary contributions, Meg, would you say? You've been following
no.
us. We have not received them, but for meals, we get meals, and we do give that back to the meals program.
Yeah, I just want to make sure nobody crosses any lines they shouldn't, that's all.
Yeah, so we will find the answer to that, and the answer will be posted on our website, along with any other questions that come through after this call. So you can, and I'll email it out to everybody as well. Any other questions?
Do we have any restrictions on the number of applications that an organization can put in? Number of programs, for example?
No, they can apply for more than one of the sections that we go through. Yep. Okay. They just have to be able to explain each one of them.
But again, I think, Meg, how many do we think we're going to award this year? 5 to 7? Yeah. Is that the right? So
5 to 6. Yeah.
The committee will decide, but obviously we do have less. Again, last year we did give a lot more, so it's going to be a little more competitive this year, I would say.
Good to know.
Okay. All right, if there aren't any more questions right now, thank you so much for joining. This will be posted on our website later, as well as the answers to any of the questions that came up. And you also feel free to reach out to us if you have any other questions, and we will add them to the question and answer on our website as they come through. And thank you so much for joining us today.
Good job. Great.